enter into the room in clinical station. I give my mark sheet to the examiner with a smile. The examiner telling me do the general examination of the child. So I wash my hand. I introducing. Suppose she is Sarah, 13 years age old, and mother is suppose Alia. So I'm taking the permissions. First of all, I wash my hand, introducing. Hello, I'm Dr. Ima. Today, one of the candidate of the exam, and I would like to examine you generally from head to toe. Is that okay? So I take the permissions. So Sarah, how are you? Okay, how old are you? Which class you are studying? So I check her communication. That is very perfect. She is mentally normal. What I noticed that she is obese in the form of there is on face. I noticed that she has acne. She has double chin present. She is very fatty and hirsutism. The girl has some extra hair hirsutism. So I understand it is going to be Cushing syndrome. Also, she can be wear glasses. Okay. I just surrounding distress device everything I notices there is no any distress the child. So I tell her, I check her neck, nothing I find in the neck. Then I tell her, can you remove the shoe and socks? Then remove the shoe and socks. I see. Then I go for back. So back there is kyphosis cholesis. Kyphosis cholesis can be present. That is I find interscapular pad of fat. Increase interscapular pad of fat. And stria, there is bruises. These are I finding. So back gait, then I tell her, can you walk for me? And then she gait is normal. Then measurement, I will take her height. I ask the weight or I measure the weight. I tell her, later I put her on BMI centile. Okay. Then I am going to the, I tell her hand. First I notice her hand. I find there is subcutaneous skin, blood vessels, skin atrophied. Okay. Then asymmetry, there is no symmetry, I change. Symmetry checking, I tell her do like me, the maneuver, there is no asymmetry. Then I make a star, so no any extra digit or any scar mark of removal of extra digit I find. And I tell her do squatting like me. She can't do the squatting. I check the upper limb power. Can you raise your hand and against the gravity? I check the power of the upper limb. Then I go the hand, I check the pulse. Axilla I check, I find there is extra hair. And I find on the eyeglasses, head circumference I take, mouth I take, I find there is some ulcer, oral ulcer or malar rash on the, if it is a case of SLE of Cushing syndrome, then malar rash. If there is any steroid oral taking, so oral ulcer can be, we find. Neck I check, then the chest auscultate, chest fully auscultations and murmur also auscultation. If I find there is crepitations, then that is maybe asthma is the cause of sometimes we can find the puffy eye and ascites, that is nephrotic syndrome also we take the steroid. So any Cushing syndrome with steroid case. I would like to complete my examination by visual field assessment because by temporal hemianopia to volar visions. I have to ask the mother about that she is taking any drug history, any steroid for a long time. Bedside to test I want to do the random blood sugar and blood pressure. So today I examine, my presentation is today I examine Sarah. She is a 13 years age old girl. She is well communicating throughout the examination. She is overweight in the form of there is double chin, acne, in abdomen there is stria, bruises I notice. On the hand there is skin is atrophied, subcutaneous blood vessels visible. She is proximally myopathy, she cannot do the squatting. Wearing if glasses I will pass comment. Hirsutism present. These are I find. If oral ulcer find, then I will tell that. If capitation find, tell. If puffy I tell according to or malar rash. What I find I will tell that. And so putting together it is a case of Cushing syndrome. How can I manage the case? First of all I will take the history. I will revise the note. Then I will run some tests. The confirmatory tests are 24-hour urinary cortisol and midnight salivary cortisols. Others are we doing the MRI of the brain for the pituitary tumor and ACTH level we do, and abdominal ultrasound MRI of the abdomen because of the any adrenal tumor. And that is so Cushing syndrome, and also according to case, like if it is nephrotic syndrome, so we do the urine dipstick test, protein test. If it is SLE, then slit lamp examination of eye, uveitis. So cause of taking long time steroid are GIA can be, it can be SLE, nephrotic syndrome, ITP, bronchial asthma. These are the can be associated nephrotic syndrome. These are can be associated with this Cushing syndrome. Thank you.